You know how people say it's just headache and I'll be fine? Well, for some people, these headaches has gone from occasionally to an everyday thing. And they just take paracetamol and brush it off. Hi, my name is Uche Namadi, and you're welcome to the first edition of the HealthWise Show. I will be your host. Today, I'm not going to be doing this alone. I have with me here my co-host, Dr. Lani Uweye, who is a doctor that will be coming from the medical angle in this discussion we're going to be having on persistent headaches. And I also have Patsy Mukunga, your regular Nigerian voice, who just wants to know how to take care of our health. Straight talks only. Please do not forget to like, subscribe, share, and follow SYNLAB Nigeria on YouTube and on Spotify. Shortly, we're going to be listening to our guest who has complained about persistent headaches. Do not go away. We'll be right back to discuss further. Thank you.
You know how people just know that they're lactose intolerant or they have chest pain or things like that. I feel for me, mine is headaches, and I've come to think that it's normal for me, even though it's not normal. I shouldn't be having headaches too frequently, but I just think it's normal for me. And here's why. Growing up in primary school, I used to like to make my hair, braids. Whenever my mommy fixed her hair, I'll tell her, "Oh, mommy, when you lose it, I want to make the hair. But just give me 2 days. I'm already crying. Mommy, I'm having headache. I want to barb my hair." So it was just like, okay, headache, we can manage it with paracetamol. But, I was just a little girl, and it shouldn't be normal for me to have headaches like that. What am I doing with myself? And yeah, and I thought of it that my mom also have these headaches, like migraines all the time. She has the drugs she use, and my mom is that kind of person that when she's sleeping, we don't wake her up because we just feel like she'll have headache. And I thought, okay, maybe it's hereditary. I don't know. Did she pass it to me? I guess I will never know because I've never asked her, or I've never even tried to find out. And there's so many experiences I had that made me just feel like I cannot not live without headache. Like when I was in my primary school doing my is it graduation now, I used to be the one to hold the mic, practice all the songs, everything. I was excited. I made my hair. Was it this pick and drop then? Everything was on point. On the graduation day, trust me, I couldn't even do anything. I was just sitting down and just looking at everybody because I had a very bad headache. I couldn't eat. I couldn't even dance. I couldn't even take pictures. My eyes were red. It was just too bad. But when I got home after the graduation, I slept and I woke up. I was better and decided to just be sad that why did I miss everything I planned for, everything I practiced? It was just so sad. But we move now. And again, my uncle, my uncle used to live in our family house then. And when he moved to Egbeda, we went to his house for like holiday. And one time we were going on a stroll. His daughter went with me, and on our way back, because it rained, the floor was very slippery, and we saw a lizard, and we were trying to just dodge, and I fell down, and I think my head just did that bounce like a basketball. So I just felt like, okay, even if I don't know why I have headaches before, this must be the cause now because my head has broken inside. Yeah, it bounced. I felt it in my ear. I heard the echo, and for days I just had headaches. I couldn't sleep. I couldn't eat. I couldn't do anything. And I didn't even tell my uncle. I just felt like let me just sleep or just, I don't know. I didn't think I should tell anybody because I already thought it was normal for me. But after 3 days, I think I used paracetamol. I slept. I felt better. So again, made me think headache is normal for me. And again, in secondary school, I was excited about my graduation, everything. We had prepared, how we're going to slay, dance, everything. On the day of the event, headache. Now, is it village people? Is it hereditary? Is it the fall? What is the cause of my headache? I'm not sure. Still, now that I'm an adult, if you're playing with me and you push my head, in my mind, I am going to have headache. And I will have headache. So am I thinking about it too much? Or is there something causing this headache? I really would like to know. I would like to know because so many events I would have, attended, excited about, this headache just keep coming. I don't know what to do. In fact, nowadays, I just try my best to take my mind off it, not use too much paracetamol because, eventually it might stop working for me. So I would really like to, what people think about it. I mean, is it just me or the other people experience this kind of headaches all the time? Is there something wrong with me? Or did my mommy pass a migraine to me maybe when she was pregnant with me? Or is it in my head? What exactly is going on with me? I really like to know.
Wow. That was a lot to take in a very short time. Like the way she explained how she thinks her head had broken inside, or how did she put it? I'm coming to you, our regular Nigerian. But Patsy, what do you think about the story that you just heard?
I'm trying to imagine what it's like to, live with persistent headaches like that every single day of your life.
Mm-hmm.
It's not something I have as a personal experience. So, like, putting myself in her shoes, it cannot be nice. I think that's what I'm thinking about. And I'm thinking about the fact that she had to deal with this as a child, because when it comes to headaches, like in my own view, headaches seem like something that happens to adults. It's like adults you hear complaining that they've been having headaches, your mom is always having a headache. But thinking that, like, it messed up her graduation. And that's something, when in my head, I'm just saying that's something a child had to deal with.
Yeah.
And that makes it.
So she would never even have a story to tell about the graduation because she
the story
was
she has
not
to tell
there.
is headache.
Is headache.
That's interesting.
Dr. Weye, what's your take on this, please, from the medical angle? What would you think, about this? What would you say?
Oh, well, honestly, that's a lot to take in because that's almost like a consistent, what she narrated.
Yeah.
I mean, that's a consistent pain that she's had to deal with all her life. And for me, I have a lot of questions on my mind. Like, okay.
Shoot.
And as a doctor, I'm asking myself, I was asking myself this question all through while the story was, going on. Did she ever visit any hospital? Did she ever see a medical person? Was there ever any test ever done? Or she just assumed
Was
that...
it just paracetamol and vibes?
Exactly. I mean, did you just assume that, oh, okay, fine, this headache is my thing, so I have to, live with it? I feel if you have a problem, then you should try as much as possible to seek for solutions. So I don't know what was done, but I feel, in my own opinion, some investigation should have been done. If someone had headaches right from when they could talk or when they became aware of themselves, then they should have as well. A parent should have taken her to the hospital. At least the pediatrician must have, reviewed her at some point.
No, I think you're underestimating just how much of, how much we see headaches as commonplace. Do you understand? Because hardly I don't think the average person or the average Nigerian is going to think, oh, I have a headache, let's go to the hospital.
No.
Even if it's persistent. And you might say, like, it's been persistent her whole life, right? But then that gives room for her to have normalized it. Do you get? Because especially if it was normalized for you as a child, where it's like you have, I've seen things like that where they tell children, like, you this one, her head is always paining her. Do you get? And nobody's taking it serious because it's just headache.
No, my own is, I actually get your point. But my own view on this is headache is a form of pain. And pain, you have to grade pain according to severity. For crying out loud, it was a pain that disturbed her graduation. So it must have been quite significant. And then if you have significant headaches, then that means it must be something that probably... Now, the typical example she gave, it affected her daily routines, it affected her activities. Now, if you were grading pain in medicine, we grade it as mild, moderate, severe. Now, for a severe kind of pain, it's something that, of course, is debilitating, doesn't allow you to function normally, to function basically. Now, for this particular kind of pain, I would say maybe I would just say it's moderately severe from what she just said, because it was strong enough to actually prevent her from doing what she ordinarily would have been able to do. You understand? So, and as a parent, I feel if you have a child who couldn't, because you know the way children are, I mean, I'm sure she must have spent weeks practicing at home and doing all that. And then you're there as a proud parent, wanting to see your child perform, and suddenly your child cannot perform because of a particular headache, that you really cannot characterize.
So I'm worried.
I feel that
they should have taken it
yes.
off. Maybe they did.
Can I come from this other angle? How about children in school? I'm talking about nursery school, who don't even know how to articulate. They can only tell you, like you just mentioned now, this child, your head is always paining you. I'm just imagining my son, probably, are they even prone to headaches? Kids.
Oh, yes.
Really?
How would what is a parent to do? Because how will you know if they keep telling you my head is paining me? How would you know, how would you navigate that? Because I've never even thought of this. An average Nigerian parent has paracetamol in their fridge.
Honest.
Yes. And it's fever. Oh, I came back from work, I carried my child. He's feeling hot. So let me give him paracetamol. When do we get to know that something is actually going on up here? Because that's another angle. When you mentioned it, I felt it's something, because I don't know how old she was in her graduation, but now I'm looking at the little kids who cannot even articulate or say what is going on.
It's not actually in your place to know the when, but to know how to react to the situation. Now, in those days, they will say, in fact, almost all adverts, drug adverts, they say if symptoms persist after 2 days, visit your doctor. Now, as soon as a child can talk and can tell you that, oh, I have issues, in this part of my body, then as a parent, because that's one of the things when I was doing I'm not a pediatrician, but one of the things that made me run away from pediatrics is because, I don't like to see children suffer, and a lot of times they really cannot express themselves very well. So, and for me, it breaks my heart a lot. But then as a parent, once your child keeps telling you that, okay, today I have a headache, tomorrow, mommy, my head is paining me, daddy, my head is paining me, and it becomes a consistent thing, I think you should take the child to at least, go for a review.
Yeah, I agree with you completely, right? But from the story she shared, I think another problem might actually be the fact that it's just headache. Do you understand? She didn't complain about any other symptoms that accompany this headache.
Yeah.
It's just headache. So it's not like she's having headache and fever. It's not like she's having headache and tiredness. It's just headache. And I still would lean into the fact that to her, it has become normal. Do you know how easily you can get used to pain or something that just occurs regularly in your life? And to somebody who doesn't have that, the minute it comes up, is going to be like, oh, I should take this to the hospital. But because that becomes so normal to you, you are living with it every day. The part of your brain that should have alerted you to oh, you need to pick this up and go see a doctor has completely fallen asleep, because this is my regular you are in normal pain. And you think pain should be, but you've been with this pain for years. It's just like
I actually think that's more or less like a mind thing. There's nothing like just I mean, pardon my use of,
at some point she was saying that am I the one now thinking it out? Because at every point in time the headache is always there.
That's my own. Sometimes when I get to see my patients, and a lot of people complain that sometimes patients overdo things, but I don't really complain about that, because one thing I know about the human body is it's like 1 minute you're like at 100, then in the next minute you're at 0. I mean, and then there's just one step between 100 and a 0. So you shouldn't take chances. So there's nothing like just headaches, because now I want to explain why to me there's nothing like just headaches, because the head houses the brain. It houses the covering of the brain, the meninges, the skull is there. There are other structures that are related to the head, the eyes, the sinuses, and then, of course, the ears and all that. And these are very vital structures. And when you come to a child, you know that one of the things that we get commonly with children is upper respiratory tract infections.
Yeah.
They have cough, catarrh, and all that. So they can have sinuses and all that. So, and when they get that, a whole lot of times they can have, headaches.
Wow.
As a result of that. Then, of course, the covering of the brain, there's the meninges. Now, what if a child has meningitis? Yeah. Because, I mean, if you have anything that is affecting the covering of the brain, that's the meninges. I mean, you're definitely going to present with that. Then the brain is there. Then inside the brain, anything can go wrong with the brain, things like that. So it could be nothing. And it could be organic, it could be an infection, it could be a tumor. I mean, there are certain tumors that children have.
You know, the thing is,
So
I
for
think-
me, and then it may not even be a tumor that is affecting the brain substance. It
might
may
be
affect the
something else.
vessels.
okay.
You know, I had someone die, a young person die
Wow.
at a colleague of mine at 30 something. He had an aneurysm. I don't know how to explain that in a layman's language. Like, you know, the blood vessel
They were
has
blocked.
lining. You understand? An aneurysm is like something like the lining of the blood vessel thins out, sometimes balloons out, you know, like that. And then you could actually have small hemorrhages into the substance of the brain. And some of these things can result as a result of congenital malformations. Where you have
Congenital, like
from birth. So you have malformations of, you know, the vessels in the brain. You understand? And then this person, it was a colleague of mine who just died. He was reading, a doctor who was reading in the middle of the night, and he suddenly just passed out. He was reading beside his wife, and then he passed out. He was in his 30s. And then before he could get to the hospital, he was dead.
Wow.
And then when they did autopsy, they actually discovered a lot of hemorrhages in the brain from aneurysm. He never detected that. He had gone all his life not knowing he had aneurysms. And there was a family history that, I mean, I think some years before that time, his elder brother also died of something
same
very
cause?
similar, you know, to that. And I could remember discussing this with a friend who now decided to go and do a CT scan. And then
found?
discovered he had one or two. You know, it's now showing me afterwards. So what I'm saying
How
is,
do we book
it's
CT
just,
scan?
you know, it was just because you said
Like-
just headaches.
No, yeah, I get
So-
that, but you know, that's how we
It's-
treat it.
Yeah. So,
We just, and you know, I think that might contribute to, you know, when she said, like, you mentioned that when she was like, sometimes she's thinking, like, is it just her mind?
Yeah.
You know, because when you are made to see something commonplace, you're having this thing that everybody sees as is not, it's just
normal.
you know, to everybody else, it's headache now, but it's persistent to you. You might even think, like, maybe I'm the one being dramatic. You don't have to start that psychological battle with yourself, like, maybe the headache is doing me because I'm the one calling it. You understand? I'm thinking about having
Yeah.
headaches, but you're actually having headaches. But because you feel like you're going to be dramatic by saying, oh, it's headache, and it's bothering me, you know, you might be in the workplace and you can't function. It's affecting your daily, but you don't know how to say it out loud that I can't do my job very well because my head is paining me. And somebody else would be like, headache that is doing everybody. Me self, I had headache yesterday. Why is your own different? And because of that, you know, like, folding in yourself, and you don't want to make it a big deal, so you're not going to talk about it. You're not going to say that I'm having headaches every day, because why is my own different? Why am I being dramatic? You get? So we've taken it as, because everybody's thinking it's headache.
yeah, I actually get you. And I was going to say something that, you know, the common presentation is headache, but then there are different types, you know.
Fair enough.
Yeah. I mean, if someone has been experiencing tension headaches, which usually you get from stress, you know that, anytime you don't sleep very well, you know, or you just deprive yourself of, you know, food, you know, for a
Yeah.
while, or you're just under any
Or
kind
even
of
screen
stress.
time.
Exactly. Then you have, you know, that. So almost everybody at one point or the other had experienced, you know,
We're all on
tension
the
headaches.
table,
You
yeah.
understand? Of course, there are other types of headaches: migraine headaches, cluster headaches, you know, on some form of atypical ones. Now, what I'm saying, what the story she narrated. Now, my own point there is, this thing has become persistent. I always tell over the years, and there's something I always tell my patients, that you are the best doctor for yourself. Now, you know, we're discussing something, you know, before we came in, and I was saying, I was discussing with you, and then we're saying something about how some people are more genetically predisposed to expressing, you know, certain form of illnesses, and then we're trying to discuss about, you know, variations in expressivity.
Don't tell me
of,
to doctor
you know,
with all this. But go
things
ahead.
like that. But you know, what I'm saying, the point I just wanted to make here is, you are the best doctor for yourself. It's your body. Now, even if the headaches, the episodes were neglected in her childhood, now that she's much older, then my own is, she should seek help. At least, you know, review at the hospital, see a doctor. A doctor will characterize the pain, will determine. For me, that headache is at least moderately severe. Now, you said something. Now, I would want to say this here. Pain can be mild, moderate, or severe. Mild pain is you just know you have the pain. It does not affect anything.
Yeah.
You can still function. And usually when patients present with that kind of pain, most times we may not do anything, and we probably would give, the analgesic that is at the rung of the ladder. You understand? If we need to. But when you have moderate pain is there is a measure of, you can still go about your activities, but then you cannot function optimally.
No.
You can still manage, but you cannot function optimally, and it does not affect your sleep that much. That falls in the level of moderate. You can still do some things, but then, there is this, you function suboptimally. That's moderate. Now, for severe pains, you cannot function. You cannot sleep. The only thing you think in your head is the pain.
Wow.
So for me, now that she's older, she should go to the hospital and she should see a doctor. She should get proper examination and review and do the right kind of investigation for her. For crying out loud, it could be an aneurysm hiding somewhere. It could be a tumor.
That's
it could,
scary.
Things like that. And of course, it can be simple migraines. A lot of women, experience, it could be as,
yes.
well, not simple, but it could, because of people experiencing it, will not tell you, will not say migraines are simple. So pardon my use of word, but then it could be a migraine. Migraine may not, it's not as sinister as maybe a cancer or something. You understand? So for me, it's, if we want to do better, for ourselves, if we want to beat a lot of medical conditions, then we need to know on time. We need to not, learn to just generalize things or trivialize, health issues. So for me, it would just, be the way to go. Now
Dr.
that she's
Wei,
older.
there is something I'm going to be asking you when we come back, because right now we're going to be taking a short break. And for you that is like me, that has paracetamol in her bag every day, don't go anywhere. Please do not forget to like, subscribe, share, and follow SYNLAB Nigeria on YouTube and on Spotify. Stay right there. We'll be right back. Hi, and welcome back to the HealthWise Show. My name is Uche Namadi, and I'm still here with my co-hosts, Dr. Olani Yoweye and Miss Patsy Mokunga. We have been discussing on persistent headaches. We've come to understand that headache is not just headache, aneurysm. Abi, that's how you call it. How did you call it?
Yeah.
It can generate or escalate quickly to that. And he rightly mentioned, that he lost somebody due to that. Please do not forget to like, subscribe, share, and follow SYNLAB Nigeria on YouTube and on Spotify. Patty, you wanted to say something before we went on break.
Before we went on
Wait
break.
now, let me talk my own before you talk your own. So now my question to Dr. Wei is, do headaches just exist, or are they symptoms of something? Because the way we abuse paracetamol in Nigeria, I don't want to talk, is it only Nigeria?
Generally.
Pain relief.
Acetaminophen,
Like in the first aid box is there. Somebody will just do small work in the oven, like, find me Panadol there. As in, it's getting out of hand,
I think
actually.
it was when I became an adult that I realized that Panadol comes with like a prescription, like you're supposed to start and take it for a certain amount of. In my mind, it's just like mental.
Just
like
take two, and you are fine.
Just,
so we're abusing
that's how
it.
I thought that for the longest time.
Dr. Wei, come and help us, because what is going on here? Because I'm guilty, because I actually have that too. Like, I cut them in twos.
Yeah, me too.
So I put one like
everywhere,
a pair in my bag. So I feel it, I take it, and that's all for the day.
That's drug abuse.
Oh,
anyways.
God.
You all are
addicts.
Addicts.
Okay, so before we even speak to the addiction, is it addiction now? Oh yeah, it's addiction and abuse. Please talk to us about headaches. Are they standalone illnesses, or are they symptoms of so many other things? Because I feel some people just be treating symptoms and not actually the main root cause.
That's actually a very, very beautiful question. Headaches are symptoms of an underlying, illness. I mean, it can be non-specific. Like, I mean, someone has malaria fever, has headaches. I mean, that's, non-specific, or typhoid, or has headaches and things like that.
Or you wear glasses and you have that headache.
Do
you have it?
No.
No. So it mirrors, what is underlying. Now, I read somewhere, someone said, pain is good. He helps you to know where the problem is.
As how?
So,
Fair enough.
headaches.
Helps you to know where the
Yeah.
problem is.
I read in one book years back when I was in the university that pain is good. It helps you to know where the problem is. So headache is a form of pain. So it actually helps you to know where the problem. And earlier I had said that headache is just pain coming from the head. And you in that head you have the skull, you have the brain, you have the covering of the brain, you have blood vessels there. You have the air related to it. You have the nose, throat, and all those organs, related to it. So one, it can be non-specific, like, when you have infection elsewhere in the body, if you have malaria, parasites, you have, bacteria, you have, any of these microorganisms, and then, you have them, it can actually, they can move in the bloodstream, and then of course the brain is highly vascularized. So you can,
have come again.
It has a lot of blood vessels. Sorry about that.
I know something.
Lawyer.
Thank you.
Okay. Yeah, the brain has a lot of blood vessels in it. So basically it can be non-specific, but then it can be very specific to the structures in the central nervous system. You understand? Okay. So it can actually mean that something is wrong with the brain, something is wrong with the blood vessels in the brain, something is wrong with the covering of the brain, something is wrong with your eyes.
Small headache.
Yes. Something is actually wrong with your hairs, your inner hair.
And people just take paracetamol and call it a day.
So, I'm still going to stand on what I said earlier on. When you have, a whole lot of people have tension headaches. And because it's easy to...
Sorry, how do you know
it's easy to spot following stress?
No, like...
Yeah.
So just following stress. What do you mean by following stress? You've not said anything, as far as I'm concerned. Because how do I know it's stressful? No, because I've heard like there are different kind of headaches. Headaches by the side.
Yeah, exactly.
Front,
those positional
and I've
headaches.
experienced.
You wanted okay.
I want to, if I'm having a headache now. How do I know is it tension headache? How do I know that I'm stressed? Because some of us don't know that we are stressed. You might just be going through your daily activities, like your regular life. Might be a stressful life and you don't even know because to you it's normal. So you're having a headache and you're not thinking that this is a tension headache. You just think it's a headache because you don't know that you're stressed.
Okay, fine. So let me characterize headaches better. Now, for tension headaches, usually you have this. Now, if you are like me, I spend a lot of time, in front of my computer. Like today, I'd spent like a couple of hours before I came. So, and I barely had up to 4 hours of sleep. You understand? So usually you have, that headache,
Sorry, Doctor, but you're the ones that preach that we should sleep 7 to 9 hours. It touched everybody.
She said something earlier that most of us in Nigeria, we actually live stressful lives. And it becomes
Lagos, Nigeria.
Lagos, Nigeria.
So you have
some Abuja people cannot relate.
So you actually have this, usually frontal. It's frontal, and then...
The one that I carry your head
do you understand?
Exactly.
I have it.
And then you can also have, the more sinister ones would, like, for example, if you're having, headache as a result of maybe a tumor or any space occupying, stuff in the brain, then you would have these headaches. It can, some more serious headaches come as, I don't know how to explain, but we describe it as thunderclap, especially with the, with the aneurysms and what, especially when you have bleeding, into the brain. I don't know how to explain, but thunderclap.
Have you ever experienced this?
How was your experience?
I've never experienced
so that we will know. We will know how. Whether it's thunder that I've been clapping since.
But I'm very sure we've all had thunders.
I'm trying to picture it. And like how could this manifest?
So,
wait, our guest said she had a sound.
No. But that was when she fell. It was on impact, not necessarily.
Yeah. So of course you can have headaches following trauma, but I'm not getting to that now. So the more sinister ones, thunderclap headaches, and then you have this what we call associated, could be blurring of vision, dizziness, occasional loss of consciousness. You can actually have these gait issues. You just, you may not notice the way you walk, your gait.
Wow.
You may have that. Then there must be, sometimes when you have, headaches as a result of bleeding into the brain, maybe from a stroke, following, an uncontrolled hypertension. You could have things like effortless vomiting. Now I will explain what that means. When you vomit,
No, I understand
when you vomit, you retch.
Yeah.
Now this one is
just
It just comes out.
yeah, and then with this headaches,
Did not even know that was a
you
thing,
understand?
bro.
Yeah, I understand. So basically, you would have all the telltale signs like pointing towards, something that is actually more sinister. Now, for people with migraine headaches, there's usually an aura before the pain comes on.
Like you kind of know it's coming on.
Yes, bright lights, loud noise, and then there's an aura, there's a way they feel, before they come, and then of course it's usually localized to one, part of the head. So all these headaches have, characteristics that define, them. Like if you have a sinus headache now, you must have a previous history. You must have had the previous history of upper respiratory tract infection. Pardon that long word. Catarrh, cough, cold, and things like that. And then I'm very sure some of us are, we've had stuffy, noses before, and then you have, feeling like you're having, headaches and all that.
Yeah.
So basically, headaches are they are things that you can characterize. And that's actually why I said from the narrative, now that the person is older, the person should go for at least a medical checkup, at least to have it checked out. It could be migraines, it could be something more sinister anyways. Because if it was an infective stuff, it would be much more defined. You understand? And from a narrative, she's been having that headaches before she even fell. You understand? So
when she now fell on impact, she now had boom.
So what we were not told was she didn't tell us rather whether it became worse after the impact or
Okay, but she mentioned something. I think she mentioned the fact that her mom had headaches. So
did it pass
is
from
there
her mom
any-
to her?
Is there can migraines be hereditary?
Well, I don't really think there's any direct relationship between migraines and heredity.
Okay, because I've even heard people say things like headaches, they run in my family, things like that.
They run in my family.
Not my family.
It's the acquisition
Well,
for
there could
me.
be like an associative, but then I don't know about any direct link between migraine and the genes. I do not know.
Okay.
Patsy, you were saying something about doctors
Yeah,
being
I was
a
saying
bit
that
dismissive.
Doctor, wait,
Let me say this. The only thing I actually know about migraines, of course, common women experience it more, than men. Yeah,
Women again. We'll talk
No,
about
no,
this
you were
one.
going to say something.
I was going to say that, like, in our discussion so far, you seem, and I don't blame you, you're a doctor, but you seem to put so much faith in doctors. Like, if you
Why won't I?
wait now, let me.
But
Do you
this
want
place
to
you are
put
going
my
to.
face in
let me-
deep
Why
here?
would he
Or
not
a
put-
babalawo or
No, but
something?
he's saying
But he's
it like
helping the professor.
yes, but he's saying it like every time you go to a doctor, they're going to listen to you. They're going to take your symptoms seriously. A lot of times, right? In a lot of instances, doctors can be very dismissive. Do you understand?
Have you had an experience?
Personally, not really, but I've had people close to me who have had doctors dismiss them severally on the same issue. Do you understand? Over and over, like it's just this. I had somebody close to me who had an issue that they kept on dismissing as, oh, it's just boils, and and this was even worse because they kept on dismissing it as boils, and it is boils caused by the fact that you are overweight, lose weight. And it was by my personal research over time, like that I was able to find out via the internet, and I was like, your symptoms align
You
with
asked Dr. Google.
Yeah, no, I didn't ask.
Dr.
I didn't
ChatGPT.
necessarily- I wasn't even going to ask, but when I read a lot, especially about skin related, because I have a wide interest in skincare. And then
I'll come to you.
so I began to see parallels, and I was like, look at this thing. It looks like what you have. And then we found out after years of suffering that she has this thing called hidradenitis suppurativa. Have you ever heard of it?
Yeah.
And she would have never known. And after I found out was when she went to the doctor and said, like, this is what's... And turned out that was what it was all the
Sorry,
while.
but what is that you just mentioned?
Me self, I can't really explain it. No, but it's a thing. Yeah, I think it's autoimmune, right? That happens with the skin, whereby it you have like what's the word? There's a way they describe it.
Antibodies.
Yes, and
Yes.
they look like boils.
Yeah.
Yes, and then they would open up some of them, and they would bring out pus. It smells really, really bad. And they are in localized areas like your
Basically.
armpits, like between your thighs, where skin rubs against each other.
wow.
A lot. And it can be very, very discomforting. And it bothered me because this is somebody I saw go through. And me, in my mind, I was like, why is it repeating?
Was the person ever referred to see a dermatologist?
Never.
Oh, okay.
And-
Okay, so that's
but
what
it was-
she's trying to say,
yes,
that it was
that it was
dismissive.
dismissed over and over. And I feel like this can happen with headaches even, where you're going and they're just, it's just headache, just... And sometimes there have even been times I have witnessed it where doctors make you look like you're being overly dramatic about something. Do you get?
Wow. So at this point, I have to ask Dr.
Okay.
Ware, what is our call to action, like for the people out there and also for the doctors too,
Okay, fine.
based on what she has said?
Okay, based on what she just said, my own take on this is I don't really think any proper doctor would see a patient who keeps coming for the same complaint and would not want to try and investigate, especially if, of course, the doctor has he has a right to examine you, evaluate you, and determine whether what you presented with is actually worth being referred to maybe a neurologist or a surgeon or something like that. So what a doctor is basically meant to do is just to assess and determine the severity of your illness and, give the necessary investigations that you would need and direct you to the proper place. You understand? But then one of the things that we don't usually also talk about, along this line is the fact that as a doctor, I've seen patients who just... I don't know. I really don't know the right word to use. We just would call you for every little thing.
Yeah, they
that they're going
they
through,
can wear
especially
you down.
health-wise. And I don't really think that's cool. Honestly, I'm speaking from the angle because, again, if you're coming to me as a doctor and I've asked all the necessary questions, there's no doctor that would not know all the telltale signs of something serious and all that. And then you are telling me no. And then I asked you all the other questions. I want to determine the severity of your pain. And from my examination, I can actually see that, okay, whatever pain you're experiencing is like either mild or, at best, maybe moderate. But then, sometimes patients like to over-exaggerate their symptoms. It's something, that's one of the things I've actually, seen.
I've seen that.
I'm very sure it happens.
You understand? So
I have seen.
If you're coming to me and actually see that all you just want is that attention, you're over-exaggerating things, of course, definitely.
You get tired.
I'll probably just say, okay, send you to... at the end of the day, if you tire me out, I'll just send you to the behavioral scientist and all that for the evaluation or something.
It's escalated so fast.
Yeah, that's no.
It went from 0 to 100.
No. I'm not saying that's not my go-to.
Some people just want
when
you to tell
when
them
it just
that they'll
becomes
be
something that
alright.
becomes
Dr. Way.
consistent, and I could see that this is something that is not serious.
I'm
then
sorry.
That's what I will do.
Psych.
Understand? But then
But
there
you can
is no
err on that
I'm
side
not-
of thinking like, oh, this person is not being serious, and then it's something serious. Do you get me?
Well, that's left for the behavioral scientists to actually help out with, especially this person.
How
never
many
judged
behavior? Because this is the first time I'm hearing of behavioral scientists.
Psychiatrists.
Psychiatrists. No, I know what
Some
you're
people
saying.
will call-
This is
yes.
This is the first time I'm hearing somebody refer somebody based on like you're being at a what's the word now? You're disturbing as a patient. Do you
like
get?
somatizing
I've
or
never
something.
seen a doctor refer to somebody to go and say, oh, talk to this person instead of me. They just dismiss you instead.
No, but I've
No,
sin that
no, it
but in the
happens.
movies though.
It
So when you keep
happens.
saying
in
I
real
have
life,
this, and they've checked,
happens. And
sometimes
then-
they just call
So
the...
before I do that, I would have
psych.
evaluated you properly, done all my necessary investigations. Everything comes back negative. All your symptoms, there are no telltale signs of something sinister. And then you keep telling me that this is severe, you're going to die. Then I have no choice.
Wow.
I have to send you to the people that will evaluate your mind.
A lot has been said, and it has been an interesting discussion. But I want to ask Dr. Ware, what advice would you give to our guest? Because she had a lot of things to say about these headaches that she was always experiencing. So what would you tell her to do? And
Well-
I know some people out there too would actually key into this because it is not just her. I'm sure there are a lot of people involved as well.
I think first off, I think she should try as much as possible to pay more attention to her body, the headaches. I mean, she should be able to know what triggers the headache. I mean, she should be able to know whether she always experiences an aura before it, or and there have been other associated symptoms. Some of the things I had earlier mentioned. Has she ever had unexplainable, unexplainable falls in the past? Has she had any period in time where there was an episode of maybe dizziness, blurring of vision, things like that. Again, another thing I actually forgot to say, I mean, I think I'm just adding this, shortage of blood that we call anemia can also, one of the commonest presentation comes with this
Persistent
also,
headaches.
yes, it can also come with persistent headaches. So
Wow.
her periods, I mean, does she, things like that. She should pay more attention to herself, know what triggers what relieves the headache, things like that. It's very,
Wow.
very important for her to, pay more attention to that. I mean, it can't just be vague, you understand?
Yeah.
There will always be answers, hidden somewhere.
Yeah.
Then, of course, a visit to the doctor, is long overdue. Then she needs to visit the doctor ASAP. Now that she's older, that she's in more control of her body and she's in control of her own decisions.
Yeah.
So it's very, very important for her to visit the doctor for proper, evaluation. It's important. And of course, if I were her, I would want to do everything. CT scan, MRI. I mean, this is something that's been there for years.
CT
CT scan,
MRI.
MRI, everything, infection
I'm just
screen,
looking at the economy.
all those things.
CT, MRI.
You know what?
It's important.
Yeah, it is actually. It
very,
is
very
actually.
important. It
Yeah.
is.
And it's,
Well,
especially when it has disturbed her that long.
Yeah, it is very, very important. I think so. That's long overdue. I know she must have also visited prayer homes. I'm sure she didn't say that. We're all Nigerian. Prayer
Faith.
homes and things
Yeah.
like that. But
Yeah.
then I think it's time for her now to see a doctor and get proper evaluation. So
wow.
it's
Thank you very
important.
much. I would like to say thank you to our guest who shared her story. And thank you to you, listener, who has been with us from the beginning. Thank you, Dr. Ware, for
Most
coming
welcome.
from the medical angle, even though you gave us some jargons that we still need to go back and go and start asking ChatGPT, what is he
That's not
talking?
true.
And to Patsy that brought the fire. The way you are just subtly tackling, as in the tackling was very subtle.
Don't mind her. She wanted us to go down. She wanted us to all be dermatologists.
Yeah.
Was going
Yes.
down
Yeah,
that lane.
yeah. So thank you, everyone. We have come to the end of the HealthWise show, and we hope that you have learned a lot. Do not forget to like, subscribe, share, and follow SYNLAB Nigeria on YouTube and on Spotify. You can also follow SYNLAB Nigeria across all social media platforms. Thank you for joining us. My name is Uche Namadi, and it's goodbye.